Hello, everybody, and welcome to another episode of the Surdentity Podcast. I am your hostess, Elizabeth Dooher Anthony, and today I am talking with Dr. Richard Downs, who I just spent some time with this past weekend in the lovely state of Wisconsin. And I got to Culver's, right? Woo, got my
Yeah.
cheese curds. And Dr. Downs is amazing. He's put together the idea of dentistry and chiropractic working together. He has a number of patents with a number of very useful products that we're going to talk about. So, hi, Dr. Downs, and welcome.
Nice to see you again. It's very nice to see you again, Elizabeth.
Thank you. You can call me Beth, it's fine.
Okay, Beth.
So, Surdentity, serene dentistry, okay, is about dental trauma. And, I've been talking about dental fear and dental trauma for almost 30 years. It wasn't until I became an orofacial myofunctional therapist that I realized that, it's the airway. I knew that people were having a post-traumatic sort of response and that they were reacting to previous experiences, but it wasn't until I learned about the airway that I put it together. So airway maintenance is really important. And, we're all, airway's a big buzz phrase in our profession lately, but airway maintenance during the dental appointment is really, really important if we want to stop traumatizing people in our dental chairs. So that's my basic message is that, if we are conscious about the airway and what people are doing to protect their airway, everything's going to go a lot easier for everybody. So what do you think?
Well, I'm a retired dentist, but I did practice about 42 years in private practice and another 3 years before that in the Navy. So um, and I'm old enough to remember when patients sat up in the chair. They weren't reclined backwards. Reclining people backward has made those with a gag issue worse.
Absolutely.
So in some of the patients that I treated, I would set them up and bring the chair down so that I could have them a little bit more anxiety reduced situation for them. The other thing I've noticed, and especially since I've learned sleep medicine, was that those people who have airway issues sleeping have a subconscious sensitivity to airway obstruction and gag reflex. So, I mean, to give you an example, I had one man that was so severe with gag reflex. It was so severe that when I walked in the operatory, he started gagging. I wasn't even touching him. He was gagging before I even touched him. So you can know that this is a huge psychological problem. And so managing these people is a very difficult thing to do. Now, some people, I mean, I very seldom resorted to sedatives and drugs. I did it on occasion, but the vast majority of the time, I worked with people psychologically to calm them down.
Yes.
And did little things to help them get used to me touching their teeth and their mouth and their tongue. Sometimes also I would use a topical. I use a Ceticaine spray on the throat, and that seemed to help a lot of people. As a matter of fact, when I had an endoscopy procedure done in through my mouth in the hospital, this nurse came in and sprayed the roof of my mouth and the base of my tongue with Ceticaine. And then I asked her if this is going to work. So she just took her finger and stuck it right down into my throat and, fully down, and I didn't gag at all. And I was convinced at that moment that I was going to be okay. I was actually quite surprised that it didn't hurt and it didn't gag me. So since I also have sleep apnea, uh, and then I don't seem to have an excessive gag reflex, but I don't know. I haven't compared myself to the normal. I don't know what the normal is. I know that people can train themselves. You know that sword swallowers do so.
Sure.
They have to figure out how to do that.
Mm-hmm.
So there's a lot of psychological component to this gag
Mm-hmm.
reflex. It's not just physical. It is it is hugely psychological.
I completely agree.
Yes. But treating the sleep apnea would be one of the things I think would reduce that. If you can get people to breathe through the night and stop going through this fight, fight or flight syndrome all
Mm-hmm.
night long, they're in sympathetic mode all night long when
All
they're
night long.
suffocating. We should call it sleep suffocation, not sleep apnea.
Yeah.
It's not a severe enough term for people to get. It's sleep suffocation.
Mm-hmm.
Yes.
And
So
and sleep, it's not like people are breathing great all day long and then all of a sudden, like when they lay down to go to sleep.
no,
So
yeah,
if sleep, if labeling things sleep gets something started for now, that's great. But it really is, it's an airway problem is an airway problem, whether you're asleep
yes,
or awake. But
yes.
I'm happy with little steps.
Me too. Everybody, I think, deserves the ability to start off with small steps and then gain their confidence. They gain their confidence not only in themselves, but they gain it in the practitioner who's working with them. And I seem to have an ability. One of my patients told me that I have I have a gift of empathy with patients. So
You know
I
what?
don't,
I have it too. And
yeah,
some of us have are gifted with a higher level naturally, but
yes,
you can learn it.
yes, you
It's a
can.
skill like
You can
tennis.
learn.
You
You
have
can
to
learn it.
practice it, but you have to
Yes,
have enough to care in the first place.
of course. I mean, if we don't care about our patients, if they're just something mechanical that we're doing in a procedure that we're trying to get out of the way, I don't know how you could ever be
Me
successful.
either,
Uh,
but everyone's, complaining on Facebook in these groups about
yeah,
the
right.
patients and that, oh, I'm burned out. And, you know,
Mhm.
my my take on that is, it's a win-win situation if I can, meet the patient where they're at and help them along with empathy. It goes better
Mhm.
for both of us.
Yes, that's exactly right. Yes.
And trauma informed care is another kind of a buzz phrase in
Mhm.
healthcare, and that is exactly what surdentity is. It's
Well, sleep apnea is trauma. It's like
Yes,
being
it's absolutely,
it's like being waterboarded all
yes,
night long.
all
You're
night
being
long.
water. Mhm. Yeah. So
And so you have a person that comes, so they can't breathe, and the night before their appointment, they have a combination of sleep apnea and anxiety. So they haven't gotten a good night's rest. And you're absolutely right. They are in sympathetic mode. They are
yeah,
functioning out of their primitive brain, and they
right.
walk into our practice, and we're expecting them to be able to make executive decisions
That's
when
right.
they're functioning from their primitive brain. And
That's right.
we're
They can't.
setting we're setting our them and ourselves up for frustration and failure.
Yes, we are. That's exactly right. Beth, I think that people need to understand that they're not rational in the chair.
Right.
And, some people with great effort might be able to grasp it. But like you said, not only are they not rational, but they haven't had a good night's sleep
Right.
because they've worried about this. So, executive decision making, they've shown if you lose sleep, if you don't get into the deep restorative sleep levels, you cannot make executive decisions very well. You constantly make mistakes. And this is why uh, people who are on residencies and are not getting any sleep are actually making mistakes with their patients.
Mm-hmm.
And you'd think the residency and internship programs in the medical and dental schools would realize that and start acting properly to make sure that these practitioners get proper sleep. You'd think so, but they don't.
Right. One would think, well, because there's that, I did it, so they have to do it. Oh,
Yeah,
I'm okay. I did it, and look at me, I'm fine. It's like, well,
yeah, yeah, yeah,
but so
yeah.
talk to me about some of your products. I'm using your
Hmm.
nasal spray and I love it.
Yeah, I just had a group in Florida that are going to start, the nurses are going to start purchasing the product for their patients.
Excellent.
I actually I sent a sample off yesterday to a superstar quarterback. I can't give you the name because I'm not allowed to, but
Right, right.
I think he's going to be interested in too because a lot of athletes suffer from sleep apnea. When you
Yes.
get a lot of neck muscles, and
Hmm.
bodybuilders are the same. Almost all bodybuilders have to be on a CPAP because they've created so much muscle that they're constricting the airway.
Hmm.
So that extra muscle in the neck is not necessarily good for breathing.
Hmm. Oh, right.
Yeah, yeah. So to ask you to answer the question, I first started my first company. I started in 2012 called OraCare Products. It's a mouth rinse. It has won the Celerant Award for 4 years in a row. It is the most innovative oral hygiene product on the market, and that comes from Celerant. Um, we just are now being approved. We've just got approved for a study and which magazine is that? Yeah, it's a peer-reviewed journal. It'll come later, but
Right, right, of
it's
course.
going to be
Gonna read it off.
appearing in September. And that article will show that our rents in this particular study done in New Jersey or Ohio. I think maybe it was Ohio.
Hmm.
Can't remember the place where it's done, but they compared OraCare rinse with just toothbrushing alone, and there was over 600% greater plaque removal with OraCare.
Wonderful.
It shows a decrease in gingival index, every kind of parameter you can think of. It's the
Hmm.
best mouth rinse in the world, and it's growing very, very well. Cancer centers are adopting it now. My little
Hmm.
neighbor girl is going through chemotherapy, and we just gave her a bottle because she was getting oral
Oh,
ulcers in her mouth. And it was within 24 hours, she was in tremendous relief.
oh, that's great.
So it's a product that we're very proud of. And we just came out with an orthodontic rinse, which will have more paloxamer, more xylitol, more other things in it that will help keep the teeth clean around brackets and bands and Invisalign. So that's coming out. And then we have a toothpaste coming out, which is made with a microfibrillator cellulose from a spruce in Sweden, I believe, a Swedish spruce
Wow.
tree. And that microfibrillator cellulose toothpaste has been shown to remove more plaque than any other toothpaste on the market by twofold. And if you use the fluoride formula, we have two kinds, one no fluoride, and the fluoride formula was able to deposit more fluoride into the enamel
Hmm.
than a prescription strength fluoride, okay,
Hmm.
prescription, and do it at the levels that regular toothpaste has. In other words, at low levels and yet better in uptake. So it is remarkable. It'll be a game-changing toothpaste that's coming on the market very soon. Now that company is called oracareproducts.com. And then I just launched these two products. This is called the hand and surface cleaner.
Hmm.
It's a
I'm using that.
hypochlorous. Yes. Um, Matter of fact, I'm recommending it not only for hand cleaning and surface cleaning, but you can spray it in your mouth, and it is actually 100 times more powerful than ordinary household bleach at killing microbes. And yet you can swallow this, put it on
Mm.
your skin, and so the therapeutic index is higher than. And then if you have anything like limes or
Hmm.
fruit at home, you spray them because there are at least 25 forms of bacteria on that surface,
Oh my gosh.
plus fecal matter. Okay. And yet people are slicing these up and throwing them in
Yum.
their drink.
Right, right.
Okay. So you can squirt that, slice it. You don't have to rinse it off, and you can
Oh
put it
my
in your
gosh.
eyes. And if you want to, you can rinse it off with water. That's fine. But it doesn't matter because this stuff is non-toxic to you. And yet it'll kill everything on there. Okay. So,
Wow.
and so you can spray it on your lettuce for to clean off the E. coli. You
Mm-hmm.
can put it on any food prep board that you're cutting stuff on. And it's absolutely fantastic for that. Plus, it's a better hand cleaner than all the stuff that you have on the market with alcohol
Yeah,
bases.
yeah,
Okay. As a
yeah.
matter of fact, in health food centers, or excuse me, in exercise centers, such as, let's say, Planet Fitness,
Mm-hmm.
you see the bottles that they have around the
Yep,
equipment
yep.
that you spray with. That's a quaternary ammonium, and you're using quaternary ammoniums in your dental offices and medical
Right. Yep.
offices, and all that does is push the spores around. It does not kill spores. This
Wow.
product will. Also, this kills E. difficile, which is a very dangerous infection. And most people are getting infected from that by going to the dental office or the medical office. They
Yep,
actually pick it
yep.
up there. Well, we're not doing a good job, and this is what you need. This, okay, is going to actually do a better job than those quaternary ammonium wipes that you're using right now, or those
Mm-hmm.
sprays in the gym. And these easily could be, you can retail these in your office and make a substantial profit with them. I suppose you can do the same with the oral rinse. And then I just came out with this nasal spray, as you talked about. And
Yep,
this nasal spray has an adjustable nozzle
yep,
so that you can spray it into each nose
yep.
or direct it so that it goes wherever you want it. You can spray it in the back of the mouth, on the palate
Mm-hmm.
where you get ear infections, and you can clean your nose every day with this without worrying about rebound phenomena. Now, these both of these products are made with hypochlorous acid. I'm a fairly well-known expert on oxidative products. The Oracare is an oxidative product, chlorine dioxide. This is an oxidative product called HOCl,
Mm-hmm.
hypochlorous acid. And then ozone is an oxidative product, O3.
Mm-hmm.
So, and then sodium chloride is also an oxidative product, which we use as well. So those items are all good for you. And this hypochlorous acid is made by your white blood cells in your body. Your body makes this.
Mm-hmm.
So it is an absolutely all natural product. And it not only does it kill the viruses and bacteria that it should kill, but it also regulates the immune system and decreases inflammation in the nose. We've shown studies where it actually shrinks the turbinates in the nose and opens up the airway. Something
Wow.
you should use every day. Nasal cleaning will help those people with the gag reflex
Yep.
because we had to pay one of my clients down in Nashville a month ago when I first introduced this product. He took it out. I gave him a free sample that night. He went and used it. He came back the next day and said, Dr. Downs, for the first time in 15 years, I didn't snore. And my wife was absolutely astounded. One night of use.
Wow.
So those are the products that we have now introduced into that. I'm introducing another nasal product that will go with this, and there'll be a tandem. There'll be a two. One's going to be a different kind of formula, and then this, and you'll use the two together. So that's coming out called
Mm,
the Dual Guard brand.
that's amazing.
Okay, yeah,
Wow. You're like, you are cranking this stuff out. And
yeah, I enjoy it.
so who's to say that dental offices shouldn't have your nasal spray in the operatory
Yeah.
for the patient prior to their injection?
Mm,
And what's wrong with
mm.
giving patients a breathe right strip or that nasal
The
dilator
nasal
tab? Yeah,
dilator, yeah, the nasal aid is a great
yeah,
dilator because it doesn't touch the septum, so it doesn't bother.
right. So
Uh,
why,
yeah,
why is this so difficult for dental people to get their heads around that you
yeah.
can make it easier for these people?
Well, I think spraying with this spray before they got into the chair would be probably a good idea because
Yes.
opening up the narrow, you probably need to do that about, I would say, 5 minutes before you treat them, just
Mm-hmm.
so that it works. Um, you could also have them pre-rinse. I tell all of my patients to pre-rinse with Oracare so
Mm-hmm.
that the fumes in the aerosols that comes out of the mouth with scalers and
Mm-hmm.
handpieces is not floating around the room and you're not breathing it in, and it's going all
Mm-hmm.
over the countertops and everything.
Right.
So you want to reduce that biofilm spray in the room. So nasal rinse or care pre-rinse to help prevent infections if you happen to nick the gums or something of this nature.
Mm-hmm.
All that stuff would be helpful. Yes, I think a breathe right strip would probably be better than the nasal aid dilator. I don't know. I've never tried the dilator on a patient in the chair, but a breathe right strip might be useful
Mm-hmm.
for some people, unless they have a lot of makeup on their nose, and then I don't
Right.
know that it would work. Okay. Yeah.
Well, but what's is I would think it'd be worth smudging your makeup a little bit to get through a dental appointment without
Yeah.
an
Yeah.
anxiety attack.
Yeah. I just don't know if it would stick. A
Oh,
breathe
right,
right.
right.
Yeah. It might
But
not stick,
yeah,
you know.
these
Yeah.
but these are things that aren't expensive, that aren't time consuming, that
Mm,
that dental people can put into action that
mm,
will make it easier. And
yeah.
you
I
know,
suppose a woman could wipe their nose off with an alcohol gauze before they put
sure,
this grip on. That
yeah.
probably would work. Yeah.
Or
Yeah.
the mute nasal dilator is pretty small.
Yeah. That would
And
work too. A mute dilator would work real well. Yes. I think
but
so.
but so instead, the patients come in and we don't do anything to help them, and then we are complaining about them when they're
Yeah.
behaving exactly as they're supposed to given the
Mm,
circumstances.
yes. That's
So
exactly right. Yeah.
um
Yeah.
I also wanted to talk with you about your putting together dentistry and chiropractic
Yeah, I'm writing a book as
practice.
well, so we chat about that a little bit when we get a chance. But I started the Dental Chiropractic Collaborative about 4 years ago, and I found it very difficult. I was advertising on the internet to bring chiropractors because I felt that chiropractic is a really uh, underutilized healthcare profession.
Mm-hmm.
Um, and I felt that when we're dealing with sleep apnea, we're talking about a non-drug, non-invasive treatment, which is exactly what they want to do. And so I felt that it was a perfect fit for chiropractic. So I began working, and I had a lot of trouble because I didn't know how to approach or bring people in.
Mm-hmm.
And then I met one person online, he wasn't a chiropractor, but his dad was. He's a marketing guy. And he brought me into Black Diamond Club and with Sean Dill and Lacey Book. And now that I'm part of that, I've been able to bring lots of chiropractors into awareness of sleep, even if they don't treat, just the diagnosis and referral. So
Yeah.
we have a program. We have a screen, diagnose, and refer program for chiropractors if they don't want to treat. And then we have another program of screen, diagnose, and treat. And we have lots of treatment that chiropractors can do. And they're FDA approved, all of them.
No
And
kidding.
oh yeah, I can actually show you some pictures of that if you want to see some of those things.
Sure. Or you can just talk about it. So these are
Okay.
like adjustments.
Well, first, one's called an INAP, which is a
Yes,
negative
I've seen that.
pressure.
Your
Okay,
INAP. Yep.
okay, the INAP is the negative pressure machine. The oral interface looks like a pacifier,
Yes, yes.
and it has a tube from it, and it goes into this container that's just about that big,
Mm-hmm.
and it's very light, very quiet. And when you turn it on, it sucks. In
Mm-hmm.
other words, it creates negative pressure rather than positive pressure in your mouth. And it causes the tongue to bring forward and up to the roof of your mouth where it's supposed to be. And
Mm-hmm.
it also brings the soft palate forward. So it opens up the airway. And it has been a very nice device, especially for mild to moderate sleep apnea, but it is approved for all degrees of severity of sleep apnea. Okay. So that's one thing that chiropractors can give to the patients. And then there's a 3-month supply of dry pads that collect the saliva. tubes and interfaces, and those things you continue to resell to the patient every 3 months, along with selling these products that you can sell to your patients on maybe a month to 2 month basis. There's a continuing revenue stream coming in, whether it's chiropractor, dentist, or hygienist, doesn't matter. So, and then you have the Excite OSA, and now the Excite OSA is a tongue stimulating device.
Yep.
It has
Yep.
a fork with electrodes on it, and it's been FDA approved for
Yep.
treatment. And it actually firms up the muscles in the tongue and improves obstructive sleep apnea events. So that's another thing that can be done. And then, of course, there are the nasal aids and the nasal sprays, which chiropractors can do. And then there's a thing called a Bongo RX, which is an EPAP therapy. Now, Bongo RX are two little discs that fit in the nose. They have a valve, and when you breathe in, there's no resistance to breathing in. The air comes in normally. But when you breathe out, there's a slight closure or restriction. So there creates an internal pressure inside the nose and the throat, just like a CPAP would do, denting open the tissues like a balloon. And so that's called expiratory positive airway pressure. And that can be done. And that's also FDA approved. You do have to have your mouth sealed so that you're breathing only through your nose, but you need that with a nasal cannula, CPAP, and you also need nasal breathing with INAP. If you can't breathe through your nose, then neither of those devices is going to work for you. Okay. Also, you have to understand that we're dealing with obstructive sleep apnea with these devices. If there's central sleep apnea, it's not going to be as effective because then you're going to need a CPAP. Okay. But I've seen a lot of central apneas disappear with just opening the airway with oral sleep appliances and INAPs and Bongo RX. So I don't know that the hard and fast rule of using only CPAPs for central apneas and mixed apneas is necessarily hard, as solid as it should be. I think we can improve even central apneas with these devices.
Yeah, and they're not super expensive. They're easy to acquire. And
Yes.
you know, so you got you have people poo-pooing stuff that doesn't have, 500 studies and it's peer reviewed, blah blah blah. But first of all, these devices haven't been around long enough to have that extensive study.
Actually, all these FDA approved devices, the Bongo RX, the Excite OSA, the INAP, all have peer review studies that prove they work. They all do, every one of them. Okay.
That's beautiful.
Yeah.
And but I wish we could give more credit to experiential.
Yeah,
I guess
sure.
it's empirical evidence. Patients don't care anyway about empirical evidence. Patients care about what happened to their brother-in-law or their mother or, their neighbor. So that's what they're going on.
Yeah. Well, I think that's true. And if you give somebody therapy and they actually feel better, whether their statistics show it or not, then you need to believe the patient that they actually are getting better rest.
Yes.
And it doesn't always show up on the stats when you're doing for a sleep image ring measurement or titrating with the Circle Plus ring. Now, those things are important too, and I don't make those and they're not my products, but I am a reseller for that. And the Night Owl Sleep Study, I'm actually a ResMed rep for the Night Owl Sleep Study, which which fits on
The
one
little
finger.
fingertip. Yep.
Yeah, yeah, and it'll do a valid type 4 sleep study, which is very helpful for screening and finding people with obstructive sleep apnea.
You know, um, all these products that you're mentioning, Primal Air that I work with, which is
Yeah.
based in Wisconsin, we used and recommended all of these products, and
Yes.
we're so grateful that that we have you not that far away to
Yeah.
be able to come and collaborate with us. It's
Oh man, I've been to three of Shirley's meetings now, her quarterly meetings up in Wisconsin, and every one of them has been very rewarding. Got to meet so many people that I didn't know and are doing wonderful work in the area of sleep health.
Mhm. Yeah,
Yeah,
Wisconsin is Sun Prairie, Wisconsin, and Madison. They're very fortunate to have
yeah,
Shirley and doing what
aren't
she's
they?
doing, and she's really leading the way in terms of uh,
Yeah,
bringing forward oral facial myofunctional therapy.
yeah. I have her on the Sleep Balance Academy
Yep.
faculty, and she is prominently shown on my website. Her credentials. She also has contributed a significant portion in my new book, which is coming out in November, which is entitled Beautiful Faces, and it, the architects of enhanced attractiveness and improved human breathing. Okay.
Mm-hmm.
So that's the name of the book. And she contributed a lot about tongue tie
Mm-hmm.
releases,
Mm-hmm.
functional therapy, and even some things on embryology and the
Mm-hmm.
development of the tongue, which I really appreciated her putting in the book for me.
So you can all this being able to read the face for signs of deficiency and recognizing um, traumatized dental patients, they're the same people.
Yeah,
When you look
yeah,
out in the waiting room, there's Mr. Jones sitting there, and he's got a flat upper lip. He's got, jowls. And you can hear him breathing across the room. You know, that's a time for me to look out there and be proactive
that's
instead
right.
of feeling sorry for myself that I have to work with this jerk. I can look and say, oh, wow,
Yeah,
he's probably got an impaired airway. And when he
yeah,
comes back and sits in my chair and refuses x-rays, instead of arguing with him and saying, well, this is required by law, blah, 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 I can say, you know what? I'll bet you have a hard time with x-rays, right? I bet you we're going to
mm,
listen. I'm going to work with you. I'm going to coach you through with breathing, and we're going to get through this. And
yeah,
newsflash, Mr. Jones gets through those x-rays and he can't believe it.
mm. Yeah. I had one. Just as a story for you that might be of interest. I had one patient who had such a gag reflex with X-rays. You know how they put the little sticker on there for
Mm-hmm.
bite wings? Well, my assistant was taking the X-rays, and he made her let him put it in his mouth
Mm-hmm.
for
Mm-hmm.
himself. So he took the X-ray and he put it in,
Mm-hmm.
and then he got scared and he took a deep breath, and the X-ray went into his throat, down to down by the larynx, and he was getting half air.
Oh my gosh.
We, I couldn't visualize it. I had to take him to the emergency room
Oh my
for
gosh.
specialized forceps removal. So, yeah, your don't ever
Right.
let your patient put that thing in their mouth
But
by
that's
themselves. Yeah,
that's a control thing because they
yeah,
are in
yeah.
panic
They're
mode.
afraid. They're
They're
in
so
panic
they're
mode.
trying to manage a
Yeah,
situation that feels unmanageable to them.
yeah. I could have
But
had a dead. I could have had a dead patient in the
yes, you
chair
could have.
just from
So,
that X-ray.
what I figured out about the gag reflex, okay? The gag reflex is about the in-breath. If a patient
Yeah,
is a mouth breather and I put something in their mouth, they feel like they can't get a breath in.
yeah,
So what I have them do is nasal breathe for a minute, just to
yes.
get it
Yeah.
going.
Make sure
And
that nasal is open. Yeah,
yep. So
yeah.
then I have them inhale and hold their breath while I place the sensor. And as I go to press the button, breathe out, breathe out, breathe out, breathe out. They're pushing the air out.
That's a good idea. Good idea.
So
Very good.
you can't gag if you're breathing out,
Mhm.
or it's
Okay.
very difficult.
That sounds like a very good technique. Yeah. Thank you.
Sure. But that
Yeah.
was, because if I hadn't have become an orofacial myofunctional therapist, I never would have known that. So I
Yeah.
would have been, just trying to struggle through,
Mm,
what's insanity, right? Doing the same thing
right.
over and over. Well, you keep
Right.
placing the thing and they keep gagging. It's
Yeah.
not, it's not helpful.
So the
So
other thing I have a problem with are patients who don't have obstructive sleep apnea, but they have insomnia. Now that's a little tricky, and pretty much the only treatment that people have had to give is called cognitive behavioral
yes.
therapy.
Yep.
I don't know that now they're coming out with nutritionals that I think are good. I work with a company called Engage that actually has developed a new sleep formula. And I gave it to a patient, a friend of my wife's. She
Mm-hmm.
used it last weekend, and she was able to sleep restfully for the first time in years with just
Mm.
one night's dose. So I know the stuff works. And of course, the guy who makes this product is a PhD physiologist from the University of Iowa, and he's the first radiation biologist in the world.
Wow.
And he is absolutely brilliant. He has uh, 14 peer-reviewed studies and numerous patents on his product that I think uh, would help treat patients with insomnia. Now we don't have just that sleep formula. We have the probiotics and the sleep formula, and even other things that can be used, like the collagen with actually an oxidizer in it. Now, most collagens don't have an oxidizer in them, so that I don't want to explain that right now,
Yeah,
but
right.
yeah, it is very unique, and the results they're getting with insomnia are pretty astounding.
That's
Okay.
awesome. And that is that available for people yet?
Yeah, sure, I can get you the link for that. Beth, sure,
Yeah.
no
So the
problem.
company's called Engage.
Yes, call Engage, and I'll send you the link for that so that you understand how to use it.
Absolutely. And I can include all that when I post this. Um,
You can. Matter of fact, the websites that all the ones that I've mentioned, of course, first one is
mhm,
oracareproducts.com.
mhm,
The second one with the nasal rinses and the stuff is called usa-guard.com.
mhm.
And then, of course, uh, the place where people get their sleep studies is called onlinehomesleepstudy.com.
Yes.
Okay, so people can go there and get their own home sleep study ordered, and then it's read by a board certified special sleep specialist. So
Wow. So yes, when I post this, I'll put all that up there. This is a
sure,
whole lot of really great information
yeah,
for for our fellow professionals
yeah,
to
good,
know
good,
that these resources are out there. And
yeah, yeah,
I really want to thank you for chatting with me today.
yeah.
I'm very uh impressed by your, just your
No, thank you.
knowledge base and your willingness to really to do something. Everybody can talk about it, but
Yeah,
you've gone out there and actually created stuff that's helpful.
yeah. Well, thank you. I enjoy it. I have a bit of a chemistry background, so that's helped me. But my main as a retired dentist, my main purpose in putting all these companies together is to support a clinic that I'm intending actually working to build in Haiti. And I've already sent down
Wow.
4 operatories of dental equipment are waiting down there. We just need to get a building, and we're going to make it a destination education place, Beth.
Oh, well, I'll love to be a
So
part of that.
hygienists can go down there, dentists, and you think, well, wait a minute, that's not very safe. Actually, we're in northern Haiti. That's very safe, and we have people there that are going to keep you safe. So, and it's absolutely beautiful. The beaches and it
Oh,
is
I'm not,
gorgeous.
yeah, I'm in. I'm all in. I'm all in.
All right. Well, we'll
So
have
let
a
me know.
destination education, and it'll help the Haitians as well as the American dentists and
Right.
hygienists.
Win-win.
Okay.
All right.
All
So
right.
thank you
Uh,
so much
yeah.
for taking the time to speak with me today. And
Okay.
I will look forward to seeing you again the next time I go to Wisconsin.
Oh, I'm looking forward to it, Beth. Okay, thank you so
You're,
much. What you're doing here is very important. Thank you.
thank you. Thank
All
you.
right.